My name's Cameron Buckley. Currently I'm a postdoctoral researcher under the Wiley Group here at UQCCR. I first started thinking about doing a PhD when I first started working as a research assistant. I never thought I would actually do a PhD, if I'm honest. I actually told my supervisor that I never wanted to do a PhD because it sounded terrifying. But having that support from a supervisor, it gave me the confidence to actually do a PhD. I think a lot of the time a PhD can sort of make or break you if you don't have the support that you actually need. For example, working in the laboratory, not everything's always going to go smoothly. So it always helps when you can actually chat to other people about it. But it does feel very rewarding once you're able to figure out actually what the issue is, and when you actually get a result that means something that you can put towards, your PhD. There was quite a lot of expertise in sort of the infectious disease area at the time I was interested in doing my PhD, and so I thought it would be a good opportunity potentially to look at collaborating with a lot of these experts. The work that I did my PhD on was Neisseria gonorrhea, which is the bacteria that causes gonorrhea. It's becoming more of an issue because we are looking at dealing with an increase in antibiotic-resistant strains. One of the biggest challenges we face is antibiotic-resistant bacteria. I think that's probably our number one priority that a lot of groups here that actually focus on infectious disease, it's probably one of their main concerns. And that can have a huge impact in terms of treatment outcomes for the patient. So we wanted to try and better understand the epidemiology of particular strains of gonorrhea and to see whether or not we could use genomics to try and help in terms of public health interventions and try and help inform potential treatment options. Even while you're doing your PhD, but particularly afterwards, people actually are starting to come to you and seek advice on how to do particular things. And they might be an expert in some other sort of area or topic. And it feels quite humbling, for them to actually come to you and ask you about advice or things that they need clarification for in terms of what you've been working on. I hope the outcome of the work that I'm involved with will sort of have its translations into public health intervention strategies that can sort of help reduce perhaps the incidence of gonorrhea, for example, before it gets to that stage where it might become very difficult to contain. If it had that public health outcome, I think that would be very rewarding.